All right, welcome back. And we are speaking about Endometriosis Awareness Month. And of course, we have online, and let's welcome our guest, Dr. Janelle Jackman. She's the vice chairman of the association. And we do also have Miss Mrs. Richard Thomas, and also Miss Karen Hickson. And of course, she is PRO, or Public Relations Director. And of course, Mrs. Richardson Thomas is Tobago officer. Good morning, ladies.
Good morning. Good morning.
Good. All right, I had some problem pronouncing endometriosis. Anyway, give us, my brother, they're drilling me and coaching me just now. They thank you guys. But let's get into it. And of course, this month, and we get into the symptoms and the painful that women have to endure and so on. So tell us the term and the purpose of this month.
Hi, good morning. So your pronunciation was actually probably good. It's endometriosis.
Yeah, endometriosis. Yes, good.
Yes. And we abbreviate that just to yes, endo. And this is debilitating disease experienced by women. Actually, 1 in 10 women are estimated to having this condition. And what it is basically the lining of the uterus. So tissue similar to the lining. It's not actually the lining. Tissue similar to the lining of the uterus. When it's found outside of the uterus, so it can be found in the abdomen, pelvis, and many other locations in the body. This causes a lot of inflammation, and women experience this as pain, pain during the menstrual cycle, pain during the month, and infertility as well. So there's a lot of different painful, I just mentioned a lot of different painful areas in the body, and infertility. Some of the symptoms women can experience with this disease, but it's basically when similar tissue to the lining of the uterus is found outside of the uterus.
All right, Doc, let's bring in Mrs. Richardson Thomas. And because I want to get into all the details, but how I'm giving you all an opportunity to introduce you and to the public and to your role. Of course, you are the Tobago officer, Mrs. Thomas. Tell us about this disease that is prevalent. They say if you have excessive period pains, it's not normal. Tell us as to your role and as you bring some level of awareness to our women.
Basically, my role within the Trinidad and Tobago Endometriosis Association, as you indicated, I'm the Tobago officer. And my main role is to create that type of liaison between the Trinidad executive and members in Tobago.
All right. We just have a little problem there. We'll come right back. Are you hearing me, Mrs. Thomas? All right, so let's go now to Public Relations Director, Ms. Karen Hickson, and we'll come right back with Ms. Thomas. Ms. Thomas, we'll get back to you in a minute, all right? All right, so yes, Ms. Hickson, good morning and welcome.
Good morning. Good morning.
All right, so you are the Public Relations Director, not officer, but director.
Yes, I am, sir.
Well, tell us a little bit about your responsibility.
Well, as the Public Relations Director, I am charged with the responsibility of assisting the TTA in spreading awareness and education with regards to endometriosis. The TTEA has been in existence since 2012, which gives us our 9th year this year, April next year. And we are a non-profit organization that, as I mentioned, brings awareness and education about the disease. We try to do that by staying current with information and research and international best practices.
Okay. All right. Mrs. Richards Thomas, are you back?
I think so.
And let's hope that it endures till the end. Of course, we know technology. All right. So your role, obviously, Tobago officer. Let's talk about, early detection. Of course, 1 in every 10 women are affected by this disease. Obviously, there are in some cases excessive period pain. Women may say, "Oh God, this is really painful," and may think that it's normal. Talk to us from that standpoint.
Well, my ability to be able to speak to you from that standpoint would only be personal, because all of us as members of the TTEA would have, to some degree, been sufferers of the disease. Mm-hmm. So my experience has been one of those personal experiences based on having my period and being told that when I had my first child, these pains would go away, only to realize that the pains increased. And at that time, I did not know what this was, what was the reason. And it's not until I became an adult and we had the internet that I was able to Google what are painful periods, what can be causes of painful periods. And I found out what endometriosis actually is. Mm-hmm. However, my colleague, Dr. Janelle Jackman, she is best poised to give you that direct answer to that question. So I would defer it to her.
Very good. All right. Well, let's go to Dr. Jackman. And all right, let's go to of course, we found out what it is, what the disease is. Let's go to what the symptoms are. And what are the women to look for? Of course, we know excessive period pain. What else?
So excessive period pain is one of the most common symptoms. So patients could have symptoms almost anywhere, because endometriosis, we tend to ascribe it to GYN disease only, but it's actually a whole body disease and could be found literally anywhere in the body. So patients could have painful urination, they could have painful bowel movements, they could have painful sexual intercourse, they could have chronic pelvic pain, meaning that apart from having pain during the period, they have pain in the same region just throughout the month that just gets really worse with the period. Patients have sciatica, leg pain, thoracic pain, and these basically give us an insight sometimes to where the endometriosis may be found in the body, depending on where the location of the pain is. And then we have the subset of patients that may not even present with pain or wouldn't even recognize that the pain is something serious, and they present to us because they have infertility. That is difficulty getting pregnant. So it's a very painful syndrome, literally can present with pain almost anywhere, concentrating in the pelvic region, and then some patients present with infertility.
Mm-hmm. Why is it so hard to diagnose, though, apparently?
Well, the reason why it's so hard to diagnose is, I would call it a two-hit theory. So one reason is because a lot of women, we're taught from the onset of period that periods are supposed to be painful. So from growing up, you get a period pain, and your mom, your grandmother, your aunts tell you, well, that's normal. Periods are supposed to be painful, more or less toughen up. This is what you're going to go through. We also promote the agenda that, if you get pregnant, this will all be over. The second reason why it's so hard to diagnose is because there's many different things that can cause pain in this region besides endometriosis. However, what we don't focus on enough in gynecology or the other specialties is the severity of the period pain. So some amount of pain may be normal, but the severity of the pain, someone who's constantly missing work or school, someone who's afraid to get their menstrual cycle, and someone who is always in the hospital during their menstrual cycle should be all things that alert you that this is not just a normal period pain. So trying to teach not just patients to recognize these symptoms, but also providers, us as doctors, need to recognize that that's like an old theory that we need to get rid of, that it's just a menstrual period pain, because many patients that present to the clinic I work in actually have been told that numerous times by OBGYNs as well. So it's not just the patients thinking this is normal, it's that a lot of doctors also do that as well. So that makes it quite difficult for the diagnosis to be arrived at. And a lot of patients are misdiagnosed, or it takes about 9 to 10 years before the right diagnosis is made.
Wow. All right. So during that time, and a woman experiencing excessive pain during her periods and so on, and she has to endure this because they may not be the symptoms that could say, yes, you are a victim of this disease, or is there another way? And I see we get into the surgery, and we'll go to the whole question of treatment. So let's say somebody experiencing this for a period of time, they went for 1,000 tests, and they came back, well, she's not aware of this disease. Is there any end to that 10 years before the 10 years, that pain is unbearable, after miss work and all of that? Is there an intervention that can be done to maybe bring some ease?
Yeah, so there are several treatments. Unfortunately, there's no cure for the disease. So that's one of the objectives of global initiatives on endometriosis to see if we can find a cure. But there are several treatments. So the first thing I would say to a woman who's experiencing severe period pain that may be listening to us today is you have to find someone that is willing to listen and to really understand what you're experiencing. And if your current doctor is not doing that, definitely find someone who's willing to listen. Even more importantly, if you think you have endometriosis, it's in your best interest to find an endometriosis specialist. And not all gynecology doctors are specialists in endometriosis. So find someone who is doing this day in, day out, who dedicated their life or the majority of their practice to this, because they will be the best person with the most experience to treat this disease.
All right. So, I'm still. All right. So, what do you look for in a doctor when seeking endometriosis care?
So, when you're looking for a doctor, look for someone who, as I said, focus a lot of their practice on endometriosis specifically and minimally invasive surgery. Look for someone who's actually willing to listen and to understand what you're going through. And then look for someone who has an array of different techniques to deal with this and doing quite a lot of treatment of endometriosis specifically. This doctor, I think, would be best equipped to be able to deal with these symptoms and be able to treat you accordingly to your symptoms, because it's not a one-size-fits-all. It's not everyone should get surgery, and it's not everyone should get medical therapy. It really depends on your symptomology as well as your future goals, particularly in relation to fertility. So all these things come into play when looking for a doctor. And the TTEA role would also be in trying to put together a list in Trinidad of these said doctors, and I know of one for sure, Dr. Brady, who is currently an endometriosis specialist, but we're looking to try and gather that information as well for the patients.
All right, let's go back over the symptoms. All right, so we got, just for clarity, the heavy period or the terrible period pains. What else?
So you can have heavy menstrual cycles, meaning that the actual period is extremely heavy, a large amount of blood. You can have pains in the period, pains in urination, pain in using the bowel, pain in sexual activity, pain in the legs, the back, pain almost everywhere. You have a lot of pain with endometriosis. You can experience infertility, difficulty getting pregnant, or subfertility, which is you may get pregnant, but it's just much harder, and you may have recurrent miscarriages as well. So all these things are some indication that you may have endometriosis, and you'd probably want to seek the assistance of someone in that field.
All right, so what we'll do, we'll go for a break, and when we come back, we speak with Tobago officer, Mrs. Richardson Thomas, and of course, Miss Karen Hickson. See you after the break.
Business owners, are you looking to engage new customers, advertise new products and services, and increase profits? We have your complete digital solution. Do you want to promote specials, products, menus, events? Here's how. Book your spot on our jumbo digital sign located in Scarborough and increase sales and impulse purchases with 47% increase in brand awareness, 29.5% increase in individual purchase amounts, 31.8% increase in overall sales amounts, 32.8% growth in repeat business. For complete digital signage solutions, call us today at 393-3038 or 683-1770.
Paying your Trico cable bill just got easier. Simply log on to www.tricott.com and choose online payment, or log into your online banking, RBL, FCB or Scotiabank, and add Trico as a pay. Yep, it's that easy. No stress, no more hassle, no more long lines. Just pure relaxation and social distancing from the comfort of your space. For more information, contact 639-4457 or log on to www.tricott.com. Trico Industries Limited. We are here for you.
In these unsure financial times, protection of your hard-earned financial assets is a priority. We at MI4 Security Cash and Transit Service are sure to grant you peace of mind. Fully insured services. Call us today at 660-7723 or 635-2144. MI4 Security Services Company Limited. Keeping Tobago safe.
Visit Dave and Daughters Hardware today on Speyside Main Road. Get blocks, cement, steel, lumber, electrical and plumbing supplies, vinyl, gravel, power tools, galvanized, and all your hardware needs. Backhaul services and delivery available too. Dave and Daughters Hardware in Speyside. Open Monday to Saturday from 9 a.m. Call 219-8436 or 353-8547.
When you need electronics, find what you want quickly at Ted Electronics. We have tons of brand name items in smartphones, tablets, LCD and smart TVs, headphones and speakers. For the best in electronics, check Ted. Amazing service and the lowest prices guaranteed. Located upstairs Moorset Plaza, Bethany Road, Tobago. Ted Electronics, your ideal choice for electronics.
Conversation about endometriosis month and month awareness month rather. Thank you guys. And we are talking with Dr. Janelle Jackman. She is the vice chairman of the association, and of course Tobago officer Mrs. Richardson Thomas, and public relations director Miss Karen Hickson. All right, so let's come back. I'll come to you, Mrs. Richardson, obviously, and so let's go now to Miss Hickson. Of course, tell us about the plans. We got all the questions out of the way dealing with this terrible disease. What to bring the awareness even more to the public besides Rise and Shine? What else the intent is for the month?
Well, the TTEA normally does a myriad of things for Endometriosis Month. Our most prominent event yearly is our seminars, which normally caters to patients, nursing personnel, or medical practitioners. And this year, even given the whole COVID-19 issue, we have still risen to the occasion and have planned our activities as usual. So we have last Saturday, we had a special series that we call Spotlight Endometriosis, which started last November and it started to end this October. We featured renowned spoken word artist Darren Sandy, who penned a poem for us entitled Being Heard. So that was a special endometriosis, Spotlight Endometriosis session. This weekend is where we have our seminars. So this Friday, the 12th, we have our teen seminar. On Saturday, we have our patient seminar, which is open to the public. Persons can register at our various sites. The website, www.endott.org, Facebook, Trinidad and Tobago Endometriosis Association, Instagram, TT Endoassoc, and of course, our email, endoassoc.tt@gmail.com for our patient seminar on Saturday. At that patient seminar, we have international presenters, national doctors, and so that will be presented over approximately 12 presenters on Saturday. Our colleague here, Dr. Janelle Jackman, will be one of the presenters on Saturday. We have Dr. Izat, and we have Ms. Heather Gudon of a world-renowned endo advocate, who will be presenting on Saturday. It starts at 3 p.m. and ends at 9 p.m. Yes, 6 hours of goodness. On Saturday. It is, as I mentioned, it is open to the public at $40 TT for members and $60 TT for non-members. And we also roll over into Sunday. On Sunday, we have our second nurses seminar, and it is second because we had the first one in 2019. And of course, last year, everything went awry. So this year is our second nurses seminar, which is open to nursing professionals. And we have collaborated with PAHO and WHO Trinidad and Tobago office, the Trinidad and Tobago Registered Nurses Association, and the Trinidad and Tobago Association of Midwives. Then on the 20th of March, we also have another special Spotlight Endometriosis session. This one is catered to doctors. On that segment, we have 4 doctors, 3 international and 1 local doctor. Again, we have Dr. Janelle Jackman, who's here with us today, presenting in that session as well. We have Dr. Nizat and Dr. Kenny Sanovo. They're all international surgeons. And our month of endometriosis culminates into our Endo Walk on the 27th of March. And again, persons who wish to register to attend these seminars that we're putting on can do so at our website, our Facebook page, our Instagram page, and of course email. You can email us and we can help guide you through the process of registering.
Okay. All right. So, Mrs. Richardson Thomas, so much is happening in this month. Let me ask you though, do you think enough is being done to bring the awareness to our women about this crippling disease?
I believe that while there's a lot being done, there's still more that can be done. And I'm one of those persons who's very thankful that the Trinidad and Tobago Endometriosis Association exists. As I had mentioned before, years ago, I did not know what this disease was. I did not know that it was a disease that I was suffering from. And there were many women in the past who suffered from the disease, and the only solution that they were aware of at the time was a hysterectomy. We have many women in our society who have been suffering with infertility issues, and really, and if you think about the culture that we have in Trinidad and Tobago, they are made to feel ashamed because they cannot have children. And the underlying factor may be endometriosis, something that they have absolutely no control over, but something that if treated early enough, if they're diagnosed early enough, measures can be put in place, assistance can be rendered to these women so as to prevent infertility issues later on. So that while the TTEA has been there, especially in Trinidad and Tobago, there's still more that can be done. And one of the things that the organization has been doing, apart from what Ms. Singson spoke about that they've been doing in Trinidad, what the organizers, what the executives have been working very hard to do is to get Tobago more involved and more integrated into the national conversation, into the national awareness. And that is primarily my role as the Tobago officer, to create that type of conduit between the two islands where endometriosis awareness is concerned. I will add here, and Ms. Simpson spoke about the activities for this week. On Friday, we've been able to get the approval from the Division of Education, Innovation and Energy to have students and teachers from all of our secondary schools in Tobago to be a part of that seminar. It's a team summit on endometriosis on Friday, the 12th of March, from 9 a.m. to 12 p.m. And the Division of Education has given the approval for that because we recognize that if we can begin to target the schools, that we can have young women becoming aware very early, being able to get their parents aware. This is where the other session on Saturday is of vital importance because it's open to the public. Because Brother B, you are getting a lot of new information today.
I tell you, yeah.
Right.
Yeah.
And as a man getting this information, I am certain that it is going to change your perception of women's menstrual health.
Yeah.
This is important.
Of course.
For the men to also understand. Let me add this other part. What the division have indicated to us. What the Division of Education have indicated, they're working on establishing their education unit, an education support unit, and they would like to be able to partner with the TTEA within that unit so that students at the school level will be able to get that kind of support. We've also gotten approval from the Tobago Regional Health Authorities Board for the nurses seminar on Sunday. And I'm saying this because I want us to understand, when you ask that initial question, if there's enough being done, I want to publicly thank the Tobago House of Assembly, and in particular the Division of Education and the Division of Health and Wellness, for approving and supporting the initiatives that we'll be having on the island, incorporating Tobagonians this week. So the work has begun, and we look forward to it continuing.
Very good. All right. And of course, we'll take that as your closing. Let's go to the doctor, Dr. Jackman. Doctor, we hear about cysts. And is it, well, you hear some women say, maybe they're not using the entire word, but say that I have a cyst and hence it's preventing me from getting pregnant and they have to remove the cyst. Is it the same thing?
So there are many causes of cysts, but endometriosis can be one cause of cyst, and that's called endometrioma. And that actually can impact on fertility. And yes, if you do have an endometrioma, one of the treatments would be to remove it. But once again, I'll emphasize, with someone who really knows about the disease and how to do this best would be the best person to seek to remove the cyst of the ovary.
And removing the ovaries is a risk. And tell us if the ovaries are removed. I remember doing a production called That Takes Ovaries, and it was about women's stories and so on. But if not, advised properly, you could remove your ovaries prematurely, or guide us as to the rule of the ovaries. But how important is that for a female in terms of her ability to bear children and so on?
Well, I love that you asked this question. So, as you said, a lot of women have their ovaries prematurely removed by people who don't fully understand the disease. The ovary is extremely important to provide hormones. These hormones not only service the reproductive organs, but also your cardiac, your heart health, as well as your bone health. So you don't want to remove the ovaries prematurely, especially unnecessarily. And there's many that you can do before you reach that step. And also the ovaries contain all the eggs that's necessary for fertility. So especially the young patient who hasn't finished her reproductive goals, meaning hasn't had the amount of children that she desires to have, removing the ovary prematurely actually causes a lot of detriment to the patient, as well as it can reduce their overall lifespan. You can actually shorten the woman's actual years of life by removing the ovary prematurely. So this is not something that you really want someone recommended to you, especially as your first time going for like consultation. If your doctor says, oh, well, the only thing we can do is remove the ovary, that might be a little indication to ensure that you're really dealing with someone who is a specialist in endometriosis, and that may be the solution in some patients, but I can tell you that will not be the first choice, and it would not be the most frequent option that we would provide for patients. So the ovary is quite important, especially in younger women who still have a lot of reproductive years ahead of them. Okay. So just be very cautious if that is the recommendation, especially your first time.
All right, let me squeeze one more question that has to do with the excessive period pains. Some women take pills or take other pills in some kind to postpone their period cycle. Is that healthy? And can that contribute to problems along the road? I don't know how to label which problem it is, but is that a practice that you want to encourage or no?
So yes, actually that is one of the treatment modalities that we have for endometriosis. It can be either medical treatment or surgical option. And under the medical, we do use hormones. So birth control pills, we have something called GnRH agonist, antagonist. And all these things basically help to suppress the ability of the woman to ovulate. That is to release that egg from the ovary that happen every month. So I'm trying to bring it down, right? So these hormones work in different ways, but their end objective are all to try to suppress the woman from releasing that egg every month, which is what will cause the rise in estrogen that really triggers the endometriosis. So this is not a bad practice per se, because this is something that we do as part of the treatment modality, but we really have to get down to the nitty-gritty of the woman's goals and objectives to best tailor the treatment option. Because someone whose main goal is to get pregnant and fertility, then you don't want to suppress her ability to get pregnant, right? That would not be the best option for her at the time if fertility is her goal. So you may more try to go to the surgical arm of things, where you actually remove the endometriosis, and hence you don't have to suppress her fertility. So it's not one size fits all. Tailor our treatment based on the age of the woman, the symptoms, as well as her end goal and objectives. But yes, definitely hormonal treatment is an option that we do use, and it consists of birth control pills and the like.
Very good. Let me ask one more question. Is this, can this become cancerous? Well, let's say that 10 years you are experiencing this painful, this experience, and you are diagnosed, and for some reason you may not do the surgery or anything. Can it become cancerous?
So endometriosis in itself actually does increase a woman's risk of endometrial cancer. It is not endometrial cancer, sorry, ovarian cancer. It is a mild increase, but it is definitely increased from baseline. What we do not have 100% for sure is if it's a cause and effect, meaning that the endometriosis is directly causing it, or if it's an association. However, people with endometriosis does have a slightly increased risk of ovarian cancer. The risk is actually so low that this increased risk is also low. So it's not that you're increasing it the same amount as somebody who has like a genetic predisposition like BRCA, but it is a slight increased risk. However, I would not use that as the main reason to do surgery or not to do surgery. It would come under one of the explanation, but it's not the main thing, because as I said, it is a slight increased risk, but not drastically from baseline.
Very good. All right. Thank you, Doc. Thank you, Mrs. Richardson Thomas, and of course, Miss Karen Hickson. I saw Davis there. I did not get your last name here on my document. However, I'm seeing it on the screen, so I guess all evidence. David. Yeah, David. Yes. All right. With that, we want to thank you, ladies, and all the best to you. And well, the awareness is out there, and the women have to check themselves regularly and to ensure that they are healthy. God knows we need our women, and of course, health is very important. Thank you, ladies.
Thank you.
Very good. All right, and you know, and again, and this is why we men have to respect, support, and love our women. When you sometimes, you know, you fellas say, you know, and she says, look, I'm experiencing some terrible pain. Those troops and say, oh God, I can't. You know, you be supportive. And what can I get you? Is there? How can I help? And so on. They have to be supportive, you know, and give them the love that they need during their time and so on. Yeah. All right, let's go for the break, and when we come back,